Thanks for joining me as we talk about the H2 receptor blockers, the histamine 2 receptor blockers, Cimetidine and ranitidine, and other drugs that are ending in the Tidine affix are histamine 2 or H2 receptor blockers. Cimetidine was the prototype of the H2 receptor blockers, and it was introduced in the 1960s. The H2 receptor blockers are still used in the treatment of peptic ulcer and also in chronic gastroesophageal reflux disease, but mainly because of the fact that they're available over the counter now, whereas it's a prescription drug to get the proton pump inhibitors. There's one distinction that I'd like to make very clearly. The antihistamines affect the H1 receptor. Those antihistamines are good for things like the allergies and allergic conditions like the itchy skin and so forth. Now, the H1 receptor and the H2 receptor are fairly distinctly different, so there's not going to be much or any crossover effects. You cannot take an antihistamine, a normal H1 antihistamine, and actually use it as an H2 blocker, and you cannot take an H2 blocker and get antihistamine effects. The histamine 2 antagonists will work all the way down in the stomach. If you go into the gastric pits, and in the gastric pits there's the parietal cells, and those parietal cells are going to secrete hydrogen ions or protons into the gastric pits. Now, that's the same cell that we're affecting as we take a proton pump inhibitor, but these are histamine 2 blockers. So in order for the protons to be put out into the gastric pits, pumped out into the gastric pits, what we need is a binding on the parietal cells of acetylcholine, which is a parasympathetic system, a rest and digest system. So the acetylcholine binding, we need gastrin binding, and we need histamine 2 binding, all at the same time. And then as those all bind, we can allow protons to go out into the gastric pit. What happens with the H2 receptor blockers is that they competitively inhibit the actions of histamine 2, and therefore there's a competition there. We block some of the actions of the histamine 2, but not very much. So in effect, the H2 receptor blockers are really not as efficacious as the proton pump inhibitors. The histamine 2 receptor blockers are fairly well tolerated, with the exception of the prototype, which is cimetidine. So cimetidine has a number of different adverse effects which are fairly common. For instance, it has anti-androgenic or against the male hormone effects. It has effects that include hypotension, headache, tiredness, dizziness, confusion, and gastrointestinal tract disturbances such as either diarrhea or constipation. But the other members of the H2 blockers do not have these side effects or have them very infrequently. So choose the other members. Always remember that the acid in the stomach plays an important physiologic role. It decreases the proliferation of bacteria in the gut. It decreases the infections in the gut. It decreases the lung infections. It also has a role in absorption of nutrients and absorption and metabolism of drugs as well. So as we alter the pH of the gut, we're going to affect all of that.